Erectile dysfunction, ED, is often dismissed as a symptom of aging, stress, or low testosterone. But mounting evidence suggests it may be something far more serious, an early and often overlooked warning sign of prediabetes or insulin resistance. For many men, ED is not just a quality of life issue. It's a signal that metabolic dysfunction is already underway, quietly damaging blood vessels, nerves, and hormone systems long before a diagnosis of diabetes is ever made. At its core, an erection is a vascular event. It requires healthy arteries, flexible blood vessels, intact nerve signaling, and sufficient nitric oxide to allow blood to flow rapidly and remain in the penis. These systems are incredibly sensitive to changes in glucose and insulin. Even slightly elevated blood sugar can begin to erode endothelial function, the inner lining of blood vessels, leading to decreased blood flow and vascular stiffness. Over time, this damage shows up where circulation is most vulnerable, in the small arteries of the penis. In fact, these arteries are so sensitive that erectile issues often appear years before cardiovascular symptoms or a diabetes diagnosis. This is why ED should no longer be viewed in isolation. If a man under 50 comes into a clinic complaining of sexual performance problems, especially if he has no obvious psychological or hormonal explanation, it should raise a red flag for underlying metabolic issues. Studies have shown that men with ED are significantly more likely to have undiagnosed prediabetes or insulin resistance. In some cases, ED is the first symptom that the body's glucose metabolism is breaking down, and the risk goes beyond the bedroom. Insulin resistance doesn't just impact erections, it accelerates aging across the entire body. It increases inflammation, disrupts hormone production, stresses the heart, and promotes fat accumulation. Left unchecked, it can evolve into type 2 diabetes, heart disease, and cognitive decline. ED is often the earliest whisper of this long-term damage. The tragedy is that many men don't realize they're being warned until much later, when damage is harder to reverse. But here's the hopeful part. Because erectile dysfunction can appear early in the process, it also provides a powerful opportunity to intervene. A man presenting with ED can be screened for fasting glucose, HbA1c, insulin levels, and lipid profiles. These simple tests could uncover metabolic risk years before traditional screenings would catch them. And if caught early, prediabetes is often reversible, sometimes in as little as 3 to 6 months with targeted changes. Regular exercise, a low-glycemic diet, better sleep, and stress management all help to restore insulin sensitivity, reduce inflammation, and improve vascular health. Many men who take action not only see improvements in erectile function, but also avoid developing diabetes altogether. The real danger lies in ignoring ED or masking it with pills like Viagra without investigating the root cause. Medications can restore performance temporarily, but they don't address the silent deterioration happening beneath the surface. And by the time overt symptoms of diabetes or heart disease emerge, that window of easy reversal may have already closed. So yes, erectile dysfunction can absolutely be a warning sign of prediabetes. It should no longer be treated as a standalone issue, especially in younger or otherwise healthy men. Doctors need to shift their approach, and men need to listen to what their bodies are trying to tell them. ED isn't just about sex. It might be the first and most personal sign that your metabolic health is slipping, and that now is the time to do something about it.